Hi, my name's Kara Zerby. I'm going to be doing IV insertion today. So before we do anything, we're always going to check the order for accuracy. We're going to perform hand hygiene, gather our supplies, which we have here. We have alcohol swab, we have our tourniquet, we have our IV catheter, which is a 20 gauge, and we know that because of the color, it's pink. We have our transparent dressing, our catheter stabilization device, or stat lock. We have our J-loop and flush already connected in, our J-loop tube primed, ready to go. No air bubbles, and then we have our gauze. Next, we're going to provide privacy to our patient, identify our patient with two patient identifiers, name and date of birth, and then we're going to ask them about if they're right or left-handed. Our patient today is left-handed, so we're going to use their non-dominant hand or arm, which is their right arm. We're going to inspect from hand to shoulder, look at all the veins. I'm going to use the basilic vein. So once we have chosen our site, we're going to go ahead and apply our tourniquet at least 5 to 6 inches above our site. Okay. Once we have applied the tourniquet, we're going to go ahead and don our gloves. And we are going to, and we've already said we've chosen our catheter size. It's a 20 gauge because it's pink. So once we have everything prepared, we're going to go ahead and clean our site right at the basilic vein. We're going to let it fully air dry. We're not going to blow on it or anything. Once it has completely dried, we're going to apply traction to our site, around the site, insert the needle bevel up at a 30-degree angle. Once we've seen a flash of blood, okay, I've seen a flash of blood, we're gonna go down to a 10-degree angle and advance the catheter a little bit further with the needle inside. And once we've gotten a little further in, we're just gonna advance just the catheter only. And pull the needle out. And once we have gotten the needle out, we're going to apply pressure, and you want to advance it all the way to the skin. Apply pressure, activate the safety, remove your tourniquet, wipe up any blood that may have gotten on the arm. We're going to want to attach our J-loop to the hub, wipe up any more blood that may have fallen or dripped. Next, we're going to apply our stat lock over the pink. We're going to apply it over the pink. And then we're going to put our transparent dressing on there. And we're then going to check for blood returns. So we're going to aspirate. I've seen blood, so it's okay to go ahead and flush the IV to ensure catheter patency. And once we're done doing that, we're going to want to chart everything that we've done. We're going to chart the date and time of the IV insertion, the patency of the IV, the size of the IV that was used, the site that we used, the dressing that we used, if the IV was leaking or difficult to flush, the position at which we inserted the IV. We're also going to want to document the tolerance, the patient's tolerance, and how many attempts it took to get the IV in, which it took just one attempt. And then once we've gotten everything documented, we're going to dispose of the needle, and the sharps container, and our biohazards in our biohazard container. And that's it.